Hello. Hello. Yeah, Ajay, you ready? Ajay, you ready?
I'm audible, madam.
Now, yes. Please start. Okay, I just introduce you to the team. Team. Now, my colleague, Mr. Ajay Utekar, he'll take up the products with you all. Okay. So, you all can understand the products from him. If you all have any doubts, queries, please ask him. And so he'll continue now, right? Okay, so Ajay, you can start.
Yeah, good afternoon, team. Uh, we are going to discuss about Riborea, that is hydroxyurea. So, yeah, my slides are visible to everyone.
Yes, yes, yes.
Okay. So, Riborea is hydroxyurea. So, we'll be discussing about it, the mode of action. So, hydroxyurea causes an immediate inhibition of DNA synthesis. Therefore, hydroxyurea is S-phase specific. So, as already you have undergone knowing about the cell cycle, so in which G1 S and G1 in the cell prepare protein needed for the DNA synthesis. And S phase, as you know, DNA synthesis occurs. So where replication. So hydroxyurea inactivates the enzyme uh, known even hydroxyurea is also known as hydroxycarbamide. It inhibits the synthesis of DNA by acting as a ribonucleotide reductase inhibitor. So you can see in the picture a ribonucleotide without interfering with the synthesis of ribonucleic acid or protein. So ribonucleotide reductase enzyme helps in DNA synthesis basically. So this is the cell cycle and hydroxyurea basically acts here in the S phase. Hydroxyurea, riborea, the indications are chronic myeloid leukemia in which solid tumor, locally advanced squamous cell carcinoma of head and neck in combination with radiation. Other indication is sickle cell disease. Uh, so hydroxyurea basically is indicated to reduce frequency of painful crisis and to reduce the need of blood transfusion in patients with sickle cell anemia with recurrent and moderate to severe painful crisis. Yeah, so coming to the dosage of Riboria in chronic myeloid leukemia, it is 20 to 30 milligram per kg administered orally as a single dose daily, which is given for 6 weeks. So the duration of the treatment is till good response, and therapy is continued indefinitely or as per the oncologist recommendation. Dosage and administration for solid tumors of Riboria are intermittent therapy of 80 milligram per kg administered orally as a single dose every third day, and then continued therapy for 20 to 30 milligram per kg administered orally as a single dose daily. Sickles, just a minute. Are you able to see the slides?
No.
Just a minute, team. It's loading. I am, madam, loading from the E drive itself now.
I told you save it in your PC in the E drive.
Yeah, I have done that, madam. Now it's loading from the E drive. Now the slides are visible.
Yes, but it's still loading. We can see, but still it is showing it's getting loaded. No, it's fine.
Yeah. So, in sickle cell anemia, as you know, 1 million cases are diagnosed every year, and RBC, that is red blood cells, are not healthy enough to carry adequate oxygens. So these red blood cells become rigid and sticky, and you can see that the shape of the RBC becomes sickle shape. So this shape is the sickle. That's why it is called sickle cell anemia. So in sickle cell anemia, the dosage of Riborea, that is hydroxyurea, starting dose is 50 milligram per kg per day as a single dose, and then patients are platelet count are monitored every 2 weeks. Then the dose is titrated by increasing by 5 milligram per kg per day for 12 weeks. Should be ensured that the dose should not exceed 35 milligram per kg per day. So that is the maximum dose. This slide is visible.
No, no.
Okay. So depending upon the yeah. Sorry, the slide is so basically I'm not able to edit it. So basically the platelet count is seen, and the depending upon the platelet count, the dose adjustment is done. So this is with respect to Riborea in dose modification. This slide is visible. Hello.
Yes, yes, yes.
So this is with respect to in case of renal toxicity, hydroxyurea dosage has to be reduced by 50%, and depending upon the creatinine clearance that is more than 60, the recommended doses for Riborea initial dose is 15, and if it is less than 60 creatinine clearance level, then the recommended dose is 7.5. So overall, it is 50% reduction, which is done in case of renal toxicity while undergoing treatment of Riboria. So hydroxyurea treatment in sickle cell anemia. So this is the LBL which we have for recommendation. So Riboria treatment in sickle cell anemia, and this is the packing. So classical fill in your prescription. So which is manufactured by Khandelwal Laboratories, and we are the sole API manufacturer of Riboria. These are some of the side effects which are associated with Riboria hydroxyurea, that is nausea, vomiting, diarrhea or constipation, loss of appetite, hair loss, and dizziness. So there are medications which doctors advise, and the toxicities are predictable and manageable. Packaging wise, Riborea hydroxyurea has a packing of 10 strips. In one strip, there are 10 capsules. So this is the carton and the strip is shown. Yeah, team. Hello. Yeah, team. Any
Hello.
questions on Riborea hydroxyurea?
No, it's please.
Hello.
Hello.
Yes.
It's please.
Yes, anyone has got any query, any doubts?
No, it is clear. You
It's
can
clear?
continue.
Okay, fine. So you can move to the next product, Ajay. Ajay, move to the next product.
Yes. Yes. So next product I am taking Gabisof. Yeah, the slides are visible. Hello, team.
It is uh,
Yeah, the slides are visible. Hello. Hello.
Hello.
Yeah, whether if we can see the slides of Gabisof. Hello, anybody can unmute and just respond.
Now you can continue. It is visible.
Yeah. So shall I start?
Gabisof.
Yeah. So Gabisof. So before that, I'll just brief about cancer. You already the basics are covered by madam. So there are growth factors and growth risk factor receptors on the cell. So this is the cell overall, and there are gene activations and oncogenes. So basically, there are two things, that is tumor suppressor gene and oncogenes. So which regulates the cell growth and proliferation. So in our body, normally the cell grows naturally for the cell growth and proliferation, but they are regulated by these two factors. So tumor suppressor gene is like a brake, and oncogenes. So you can see that if there is a mutation in the cancer, because that active oncogene is activated, as a result, it's like in car there is no brake, so cell starts multiplying abruptly. So just to give a brief idea with respect to oncosuppressor gene and oncogenes, they act equal and opposite and maintain the cell apoptosis, that is cell death, and natural growth of the human body. Coming to cancer cells and normal cells, you can see in normal cells the oncogene expression is rare, and intermittent coordinated growth factor secretion takes place. Presence of tumor suppressor gene is there. As a result, you have a programmed cell growth and programmed cell death. So our human body grows according to the natural physiology. However, in cancer cells, there is a loss of contact inhibition, increase in growth factor secretion, increase in oncogene expression, loss of tumor suppressor gene, and neurovascularization. So what is EGFR? Basically, EGFR is an epidermal growth factor receptor. So which is basically a protein which is there on the surface of every cell. Everybody can hear properly, and the slides are visible. Hello.
Your slide is got is not moving. It's just a second slide which is seen.
So I am on the slide number 6 now on EGFR growth factor receptor. Is
I
it the
can
same?
see I can see only your second slide. You all are able to see the sixth slide?
Hello.
Yeah, we are.
Which slide you are able to see? What is there on the screen currently?
On
Hello.
hello.
Yeah.
We are
Which
on
slide?
slide 6.
Okay. And what is the content on the slide? What you can you read out?
Epidermal growth factor receptor.
Okay. So we are on the same loop. So maybe due to the internet, there was a gap. So epidermal growth factor receptor, basically it's a protein found on every cell which helps and which epidermal growth factor binds when EGF, that is epidermal growth factor, attaches to the EGF receptor, and it activates the enzyme tyrosine kinase, and which triggers reaction which cause cells to grow and multiply. So basically a mutation in the gene of EGFR can make it grow too much, which will cause cancer. EGFR is found at abnormally high levels in the surface of many types of cancer cells, which may divide excessively in the presence of EGFR, EGF. The EGFR TKI attaches to EGFR receptor and thereby inhibits the attachment of epidermal growth factor and stops cell division. Tyrosine kinase is a protein found within some tumor cells, so which is responsible for sending signals and to maintain constant proliferation. That is, proliferation means growth of cells. So you can see in the picture, there is an epidermal growth factor receptor is shown, and tyrosine kinase domain inside. So basically, this ensures cell cycle regulation, cell proliferation, and angiogenesis. So inhibition of apoptosis and increased survival. So tyrosine kinase inhibitors, the ability of tyrosine kinase inhibitors to function, thereby limiting cancer growth. Tyrosine kinase inhibitors causes rapid cell death by shutting down cancer cell survival mechanism. So everybody has understood about EGFR. Any doubt till now here? Hello?
No, you can continue.
Yeah. So coming to the molecule now, geftinib, which is basically an tyrosine kinase inhibitor. So it is an oral medication. It is the first EGFR TKI to be approved by in the treatment of advanced non small cell lung cancer. It targets and blocks the activity of EGFR receptor tyrosine kinase inhibitor. So you can see in the picture also here. Original brand is Eresa, which was launched in 2002. So coming to mode of action, basically geftinib blocks the activity of EGFR TKI. Studies have shown that tumor with EGFR mutation are particularly sensitive to geftinib. So mutation in the EGFR is characteristics occurring in about 10 to 15% of non-squamous cell lung cancer patients in Europe. So mutation in EGFR is a characteristics occurring in about 30 to 40% of non-squamous non-small cell lung cancer patients in Asia. So this is the overall incidence of mutation occurring in both the parts, that is Asia. So EGFR pathway and EGFR mutation, you can see the ligand here and EGFR TKI, and which results into basically inhibition of cell growth and proliferation and inhibits the mutation. So you can see with Jectinib, the angiogenesis is inhibited, mutation is inhibited, and inhibition of apoptosis. So EGFR mutations are more common in non-smokers, patients with adenocarcinoma histology, females, and Asian patients, basically who are more smoking, non-smoking. So Jeftinib is indicated for treatment of adult patients with a locally advanced metastatic with activating mutation for EGFR TKI. So dosage recommended is 250 milligram tablet once a day. The duration of dosage will be as per the till disease progression or as per the recommended by oncologist, or normally in oncology it is as per the toxicity. So either the treatment is changed, or if the disease is progressing, the other drugs are preferred. Side effects associated with Jeftinib is mild to moderate rash, which is on the skin, and mild to moderate diarrhea. So coming to the packaging, Jeftinib is available in the tablet form. So it is a pack of a strip of 10 tablets available in 250 milligram. Our brand name is Gabisof, manufactured by Khandelwal. So some silent features of Jeftinib: it blocks the activity of EGFR TKI, and it is superior over carbopacly in first line treatment EGFR. So there are several protocols in NACLC advanced. So it is first line treatment, it is recommended. Jeftinib demonstrates significantly longer progression-free survival for Asian patients compared to carbopacly protocol or regimen. So team, any questions on Gabisof or EGFR?
No.
Hello?
No. Hello.
Yeah, SLA. Yeah, if I am.
Yeah, hello.
Yeah, any questions you have?
We haven't question.
So shall I
You can proceed.
proceed with another brand? Yeah, team. Hello.
Hello.
Yeah, SLA. Any questions from you, the entire team?
Hello, Mr. Ajay.
Okay, shall I proceed with other brand then? Hello.
Hello.
Shall I proceed with other brand?
Yes.
Okay. So another brand which we'll be discussing is Temazol, that is temozolomide. Yeah, I'm downloading the slides. Yeah, everyone, whether the slides are visible, anybody can respond.
Yes.
Thank you. So, so everybody knows about the, I think, human nervous system, which has brain, spinal cord. There is nervous system, that is parasympathetic, sympathetic, and the entire body functions, the motor and sensory nerves. The communication goes through the nervous system. So basically, we will be focusing on brain with respect to temozolomide. So brain, as you know, everybody, it controls the system of human body. So brain metastasis may impact other vital functions. Hence, there is a need of a drug which passes the blood-brain barrier and to kill the brain tumor cells. So the idea behind showing this picture was that how vital it is to address the metastasis in brain or GBM. So we'll start with the anatomy of brain. So brain is made up of 4 parts. Cerebrum, the largest part, as you can see. Whether the slide is visible? Hello?
Yes, it is visible.
Yeah. So Fauzia. Yeah, Fauzia, you are admitted. Made up of 4, basically brain is made up of 4 parts. Cerebrum, the largest part you can see, and cerebellum, which is located at the back part of the brain, below the cerebrum, and the brainstem, which connects the brain and the spinal cord. Meninges, the membranes are surrounded the brain and the spinal cord. So brain cells, the structure within the brain cells are made up of about 100 billion neurons and trillions of support cells called glial cells. So these are neuroglial cells and neurons. So you can see there are different names: astrocytes, synapse, myelin. So there are different names of brain cells, and they have their unique role and function. So basically, cells in the brain are classified into neurons, neuralgia, and other supporting cells. So glial cells are further classified into astrocytes, oligodendroids, and microglia, Schwann cells. So you can see that there are different structures and they have their unique role in the brain to play. So coming to glioblastoma multiforme, which is the short form is GBM, which I was talking. It comes under the group of tumors referred to gliomas. So basically GBM develops from the star-shaped glial cells. So you can see this is a glial cell, that is astrocytes, which we saw in the classification of glial cells. So GBM develops primarily in the cerebral hemisphere, but can develop in other parts of brain, brainstem, and the spinal cord. The rising star of the brain is called astrocytes, which you can see the structure is star shaped, so it is called star shaped glial cells. Its function is to hold the neurons in place. So neurons, as you know, the function is communication. It gets nutrients for the neurons and they communicate with neurons and modify the signals they send or receive to different body organs and the parts to carry out the various vital functions in the human body. So brain tumors, if you see incidence wise, 28,150 was seen in Globacon 18. New cases of primary tumor every year are seen. So the incidence here, and it is among the 10 most common cancer in the country. So this is Indian statistics overall. So brain tumor is defined as an abnormal and uncontrolled growth of cells in the brain cells. The brain tumors can be benign or malignant. Even benign tumors can be dangerous. Both types of tumor should be treated as early as possible. So you can see this benign and malignant, how it is seen. So this is the general benign and malignant definition of any type of cell. When it comes to brain tumor, these are the visible. So how is brain tumor treated basically? So you can see brain tumors can be treated with a multidisciplinary team of surgery, radiation, chemotherapy, and immunotherapy. So the oncologists, radiation oncologists, and the surgeons, they collectively plan the treatment depending upon the staging, grading, size of the tumor, that way. Okay, so you can see here surgical operative procedure going on, and here there is a radiation. So brain tumor treatment surgery, often first treatment used only treatment for the benign tumors, because benign means it is localized, it is not growing. So removal requires removal of for removing this brain tumor, you require to do a procedure called craniotomy. So basically craniotomy is what? Cutting the bone and getting it aside and extracting the tumor which is present below the skull. So this process of surgery is called craniotomy. Removal of tumor can relieve symptoms if it is creating pressure in the brain. So if the tumor is growing exponentially, definitely it will put a pressure inside the skull. So as a result, the surgery has to be done. So craniotomy is done. So surgery, the purpose of the surgery is to cure whenever possible. So, sorry, the word cure is not there, but to manage the treatment, to remove much tumor as possible, so that the other treatment like radiation, chemo can manage the tumor cell killing. So surgery is not possible if tumor is in the brainstem or certain other areas which are inoperable. So brainstem and spinal cord and all, it is inoperable, but if it is in this region, it is operable. So brain tumor treatment with respect to now coming to radiation therapy. Radiation therapy is nothing but high energy X-rays to destroy the cancer cells, to understand in a simple way. So gamma rays, there are different rays given depending upon the cancer type. So in with respect to brain, the radiation oncologist decides the dose, and they give different dosage of radiation. Provide greater different methods delivery are used, and greater precision and reduction of radiation exposure are used. A combination of two or more techniques can also be used. So in radiation, there are different techniques. This picture is a stereostatic radiation technique. So there are more focused. Earlier there was cobalt. So in brain, it is more focused radiation treatment strategy is used. So these are radiation techniques. You can see pictorially. These are gamma rays. So there are different types of rays which are given, and you can see a whole brain radiation therapy that avoids certain vital functioning of the brain has to be retained. So there is nowadays more programmed and targeted radiation treatments are given. So what are the indications of radiation treatment to be given in brain tumor? Following surgery, after the surgery, tumor cells that may remain in the area, so which we call residual cells. Like once the surgery is done, around the surgical margins where it is there and periphery, the radiation treatment is given to take care of micrometastasis. That is, further cell growth should not happen, so radiation is given after the surgery. In patients who cannot have surgery, other indication for radiation therapies who cannot have surgery, where it is inoperable or it is located in the brain stem or spinal cord. In those cases, the radiation treatment is preferred in management of brain tumor. So what are the side effects? Basically hair loss, headache, and radiation necrosis. So I have just shown a picture of what is necrosis it means. So it is shown here. So brain tumor treatment with respect to chemotherapy coming to, which is used to kill the cancer cells. So in cancer, it is always a multidisciplinary treatment. So in case of brain tumor, it is surgery followed by radiation, followed by chemotherapy. So surgery and radiation will be depending upon the size and operability and inoperability of the tumor. So given to destroy cancer cells, chemotherapy is given to destroy the cancer cells remaining after the surgery and slow tumor growth and reduce the side effects. A combination of medication is often used. Some drugs go through the blood-brain barrier better. So you can see I had just shown a picture of blood-brain barrier. Basically, our brain has a blood-brain barrier. So this importance of this blood-brain barrier is that it does not allow any foreign particles to enter into brain. So that because brain is a very vital function, so there is this, it permits only certain things into the brain. So in order to kill the brain tumor, we need a drug which will pass the blood-brain barrier in a better way. So these are some of the side effects of chemotherapy: nausea, vomiting, loss of appetite, diarrhea, fatigue, low blood count, bleeding or bruising, numbness, tingling in the hands and feet. Tingling means it's a like neuropathic disorders, a headache, hair loss, and skin darkening, and sometimes fingernails get damaged. So coming to gliomas, so gliomas include astrocytomas, which we saw in the classification of brain cell already, which accounts to approximately in the primary brain CNS tumors in USA. The statistics it is shown. What are the different types of gliomas seen in US? So almost 20,500 new cases are predicted in US annually, and the death incidence is around 13,000 per year. So clinical complications: aggressive tumor growing with gliomas growing within enclosed cranium. They distort the adjacent brain tissue and increase the intracranial pressure. Headache, nausea, and vomiting, personality changes, and slowing of psychomotor functions. That is, psychomotor functions means whatever our movement of hand and all those things gets impacted. So these are called psychomotor functions, which brain get impacted because of gliomas. Seizures, that is 19 to 47% of the patients come across seizures. Intratumoral hemorrhage is seen in among 16 to 7.8% patients. Craniotomy wound healing complications, that is the surgery, the complications are 0.5 to 13.6%. The patients who are undergoing craniotomy surgery. So venous thromboembolism, the incidence is 4.2 to 31.2%. And so there are a lot of complications in surgery and radiation treatment undergoing. So the overall perspective of telling and sharing with you is this. Use of corticosteroids adding more morbidity. So used in brain tumor patients with symptomatic peritumoral edema to reduce mass effect and lower intracranial pressure. Use of high dose corticosteroids contributes to overall treatment morbidity in the glioblastoma patients. So steroids have a lot of long-term harmful impact and complications in administration. Steroid reduction and tapering, steroids are basically like a double-edged sword. So patients' goal of tapering is discontinued corticosteroid administration. Unfortunately, ineffective treatment options for patients with relapse disease have prevented major progression in this area. So overall gliom GBM, it's challenging. So what is treatment landscape in case of relapse GBM? So surgery, that is we have seen the role is basically tissue diagnosis and debulking, that is reducing the tumor size, and then giving radiation along with temozolomide, then best supportive care and drug treatment with platinum based regime and temozolomide and other protocols. So coming to temozolomide, which was developed in 1980s through rational drug design. It's an analog of dicarbazine with broad spectrum of anti-tumor activity in animals and men. Temozolomide, unlike dicarbazine, which require metabolism in liver, temozolomide simultaneously converts into active metabolite called MTIC at a physiological pH. Physiological pH. So what is MTIC? It's basically chemically formula is 3-methyl triazine imidazole. So it's a chemical formula basically. So you just remember MTIC. So which is an active metabolite of temozolomide. So temozolomide once enters the cell, it gets converted to MTIC. So this is the chemical structure of temozole, and you can see in pH more than 7, that is more than 7 is basically alkaline, spontaneously hydrolyzes. Hydrolysis takes place and methyl diazonium ion. So this is basically to share you that temozole once enters the cell, it gets converted into MTIC. So as we were discussing, in mechanism of action of temozolomide, it enters the cell, hydrolysis takes place, and opening of heterocyclic rings. You saw this, these are the heterocyclic rings. Release of MTIC and CO2, which results in degradation into methyl azoonium ion and reactivates methylating compound. So, sorry. This ion methylates DNA sequencing and formation. So there is a series of action taking place. Basically, DNA strands gets damaged. So the purpose, once the temazole enters, so it damages the DNA. With entire this reaction taking place. Okay. So once the DNA is damaged, the cell death occurs of cancer cell. Is it clear? Any doubt on the mechanism? Hello?
No doubt. We can continue.
Yeah. So basically you have to remember that temozolomide gets converted into MTIC, which helps in damaging the DNA, which leads to cell death. This is how the mode of action of temozolomide. So recurrent astrocytoma, you remember, it's a type of brain cell. So this is a recurrent good response with temozolomide post surgery. So this is a case where patients were operated and post surgery. This is the result after giving temozolomide after radiation treatment. So how the doctors analyze the progression or control of disease? This pictorial. Classification, coming to classification, cytotoxic agents, chemotherapeutic agents and alkylating agents. So which is the approved indications for GBM in combination with radiotherapy, it is used in treatment of adult patients with newly diagnosed glioblastoma multifore and then in the maintenance therapy. So temozolomide basically used in treatment of adult patients with recurrent or progressive glioblastoma multifore or anaplastic astrocytoma after standard therapy. Which is the standard therapy? Surgery followed by radiation. That is called standard therapy. So this is pictorially, you can see the glioblastoma. This picture denotes the pathological when the cell tissue is taken and viewed under microscope. The GBM, it looks like that. And when it comes to pictorial presentation in scan, it is shown like that. Other applications of brain metastasis. Previously treated as well as recurrent temozolomide is chemotherapy option since brain metastasis do not respond to many drugs. So chemotherapy can be, temozolomide can be given after the other chemotherapy protocols which are recommended in GBM. So temozolomide is well tolerated agent, and the most important, it passes the blood-brain barrier so that it can act on the brain cell. So role of temozolomide in newly diagnosed GBM. Temozolomide given concomitantly. So this is one of the clinical trial where the trial was done in one arm radiation was given, other arm radiation with temozolomide. So it is seen that overall survival is beyond 14.6 months with temozolomide addition to radiation therapy. So rather than giving radiation treatment alone, radiation with temozolomide post surgery is recommended. So coming to temozolomide dosage. Hello, you can see the slides. Is it visible? So newly diagnosed glioblastoma multifore, the concomitant treatment is 75 milligram daily for 42 days with the whether the slide is visible to you? Hello.
Yes, it is
Yes.
visible.
Yes, it is visible.
Just a minute.
Mr. Ajay?
Yeah, just a minute, just a minute. I am opening the slide only. Okay. So coming to, there is a concomitant treatment of 75 milligram daily for 42 days and which is given and then followed by maintenance. So from cycle 1 to 150, 1, then 150 milligram once daily. So which is then given for 5 days followed by 23 days rest. Then cycle 2, it is 250 milligram once daily. Again, the similar way, it is given for 5 days and followed by 23 days rest. So temozolomide in the refractory anaplastic astrocytoma, the dosage recommended is 150 milligram per meter square to 200 milligram per meter square orally once daily for 5 consecutive days per 28 days treatment cycle. So addition of temozolomide to radiation therapy prolongs the survival. So this is a pictorial graphical presentation. Already we shared the data. It is increased by. So this slide, it is increased by almost for more than 4 months. And this is the median overall survival. Okay, so the same thing it is showing, it prolongs the survival when it is added to the radiation therapy. So most of the radiation oncologists and the oncologists recommend temozolomide along with radiation. So this is a dosage calculation chart for easy calculation. As per the body surface area, you can see, and the recommended dosage, whether it is concomitant or maintenance or refractory case. So as per the body surface area, so example I'll just share 1.5 body surface area. If the dosage is 75 milligram per meter square, the calculated doses will be 112. So 100 milligram tablet has to be given. Okay, as per the dosage and the duration recommended. So this is a dose modification. So this normally oncologists manage. This is only for your information. Depending upon the platelet count, the dose adjustment is done in case for temozolomide. If the platelet counts are down, and then it is adjusted. This is, see, every oncology drug has hematological and non-hematological toxicities. So even temozolomide have certain toxicities. So these are like absolute neutrophil count levels are monitored during the treatment of temozolomide, and as per that, the decision is taken by the oncologist whether to continue, discontinue, or reduce the dosages. So this is for your just information purpose. So depending upon the absolute neutrophil count, platelet count, these things are decided. Okay, and other non-hematological toxicities like alopecia, nausea, and vomiting, the dose adjustment is done by the medical oncologist or radiation oncologist. So dosing administration is in fasting state at least 1 hour before a meal. So this is the dosage guideline for temozolomide. Antiemetic therapy may be administered prior to or following administration of temozolomide. The duration of treatment, temozolomide therapy can be continued until disease progression or for maximum up to 2 years. Okay, so normally doctors examine after surgery, after radiation, what is the status of tumor, and then they decide whether to continue temozolomide or not. So normally it is still disease progression or maximum up to 2 years as per the physician's analysis. Okay, so here there is one example of one patient case which is showing that this is a new GBM patient. So after surgery, how it looks, and after giving chemotherapy, what is the shrinkage, chemo and radiation, and after on temozolomide for almost 2 years. So cancer may reoccur or may not depending upon the patient's response. So these are the guidelines, NCCN guideline. So as you know, NCCN stands for National Comprehensive Cancer Network. So in which adjuvant treatment, radiation therapy with concomitant temozolomide is given along with radiation therapy with concurrent and adjuvant temozolomide. In recurrent therapy, also temozolomide is recommended, you can see, and other recommended regimens. So concurrent chemotherapy administration on the same day, that is the meaning of concurrent, means along with the radiation therapy and on the same day. What is sequential chemotherapy radiation, SCRT, usually administered as 2 or 4 cycles of chemotherapy prior to radiotherapy. Temozolomide is an oral alkylating agent that is used simultaneously with radiotherapy as well as adjuvant chemotherapy after. So what are the contraindications? Patients with history of hypersensitivity to components of formulation or dicarbazine. So these are some of the contraindications of temozolomide patients taking. So what are the adverse events or reactions? Thrombocytopenia. So just to understand what is thrombocytopenia, Basically, thrombocytopenia is reduction in platelet count in the body. So how a doctor is physically able to know? This is the picture shown of thrombocytopenia, and there is a reduction in platelet count. Rest indicate adverse reactions, as you know: nausea, vomiting, constipation, alopecia, loss of hair, headache, constipation, fatigue, and convulsions. So temozolomide highlights coming to is an effective primary brain tumor as well as metastatic brain tumors. So temozolomide effectively in recurrent as well as newly diagnosed cases of high-grade gliomas. So our temazole effective in low-grade gliomas can postpone the radiation treatment. So temozolomide highlights good adjunct to radiation because of its radiosensitizing effect. Temozolomide has a better quality of lab in relapse patients. Relapse means if the cancer reoccurs, then it is re-challenged with temozolomide and radiation combination. Ease of administration, orally administered, and it has good bioavailability after oral administration. So it's a well-tolerated drug, better metabolic profile, and mainly excreted by kidney. Temozolomide minimum drug interactions. Coming to the packaging, as you know, we have four formulations: temozolomide 20 mg, 100 mg, and temazole 250 mg. Thank you, Tim. Any questions on temazole? Fauziya, Tehsil, Rahmat. Hello.
Everything is okay.
Hello, hello.
Yeah. Any questions on temazole?
No question.
So I'll just speak to madam whether we have to take other brands, or I'll just speak to madam. Deepti madam. Any doubts? Any questions you have?
No, we haven't.
I'll just speak to Deepti madam and get back to you. 2 minutes.
Hello.
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 Yeah, Tehsil. Tehsil, no?
Yeah.
Yeah, yeah. Tehsil, shall I edit out on the Riborea, Gabisof, Temazole, or anything in oncology? Anybody has any doubts? Shall I go to another
No, we
brand?
haven't doubts.
Okay, shall I go to other brands? Hello, shall I
Shall we
start?
continue by tomorrow?
Can we take one more brand so that it would be?
Okay, you can. Okay.
Huh? So I am taking Acti top.
You can continue now.
Yeah, yeah. Just I am connecting other slides. So we will take up Actitop. Yeah, Tesale. Whether the slides are visible?
Yes.
Uh, what you can
No,
see on the
the slide is not visible.
just a minute. That's why I'm checking here.
Actitop.
Actually, because of internet gap, it takes time to.
Now,
Yeah,
now it is visible.
yeah, it is visible. So Ethiopia. So Ethiopia is the country of mountains. Yeah, Tesale. Hello. Hello.
Hello.
Yeah. So Ethiopia is basically country of mountains, known for mountains and nature. I am audible to everybody?
Yes,
Yeah. Shall I start?
you can start.
Yeah. So it Actitop capsule, which is etoposide phosphate capsule. So straight away coming to mode of action of uh, etoposide, that is basically DNA synthesis inhibition. See, most of the drugs basically inhibits the cell DNA damage or DNA uncalling, and the action is like that. So as you have undergone the training of basics of oncology, so as you know this, there is a cell cycle in which there are various phases: G1, M, G0, G2. So basically etoposide, it appears in the G2 phase of the, it acts on the G2 phase of the cell cycle. So you can see here pictorially, etoposide leads to double strand breaks in the DNA. So irreversible double strand breaks in DNA. So this is one slide which gives you an idea कि overall in the cell cycle, different drugs act at different cell cycle and different pathways. So you can see here vinca alkaloids, taxanes, etoposide. That's why in oncology there is a combination of protocols given so that the cells cycle, uh, cell growth is inhibited and cancer cell dies. So these are some of the other mode of molecules you can see in the cell cycle acting at it. So here etoposide you can see it is acting in the G2 phase. Okay. Similarly, other oncology drugs they act on the different phases of the cell cycle, basically to kill the cancer cells. So I am just showing these pictures to understand why combination of protocols are given in different types of cancers. Okay, so different three drug combination, two drug combination. So idea behind showing these pictures is that different molecules act on the different phases of the cell cycle. Is it clear? Tasale? Any doubt? Is it clear why combination of drugs are given in different cancer types.
Yes, yes.
So indications of Actitop coming to it is small cell lung cancer and testicular cancers. So small cell lung cancer, as you know, it's a type of lung cancer, and testicular cancer is related to testes, which is a part of male reproductive organ. So specifically designed for chemotherapy naive patients, elderly patients, and outpatients. So these are some of the indications of Actitop, which is etoposide, is the molecule name. So dosage and administration is 175 to 200 milligram of etoposide capsules daily for 5 consecutive days orally, followed by cessation or withdrawal interval of 3 weeks. Means 3 weeks gap is given. Okay. So daily for 5 consecutive days orally, followed by cessation of 3 weeks gap. Therapy can be repeated if necessary. So normally all these drugs are continued depending upon the disease status. If the disease is progressing, another molecules are preferred. If disease is stable, there is a good response, and this is stable or complete response, then the same treatment doctors continue. So recommended dose for etoposide capsule is 2 times the IV dose, rounded to nearestly about 50 milligram. So uses of etoposide capsule, it is used to treat lung cancer. It is used to treat testicular cancer. Already we discussed that. So these are some of the protocols. So I had showed you the cell cycle and different drugs acting. So that is the reason in oncology combination of drugs are used, so that the cell growth, proliferation and metastasis is prevented in the cancer cells and in small cell lung cancer cell. So the oral etoposide regimen means regimen or protocol is a terminology used for combination of drugs in oncology to understand simply. Cisplatin 100 milligram per meter square IV on day 1, and etoposide, that is Actitop, 120 milligram per meter square given IV from day 1 to day 1, and 240 milligram per meter square orally day 2 and 3. So every 4 weeks maximum of 6 cycles are given. Okay. So milligram per meter square means what? Can anybody tell? Hello.
Body surface.
What is
It
120
indicates
milligram?
body surface area.
So this is the dosage recommended, but it is multiplied with the body surface area, and the exact dose is administered by the nurse or the oncologist. Okay. So milligram per meter square is nothing but meter square is for body surface area. So if the body surface area is 1.5, it is multiplied by 1.5, and the respective dose is calculated as per the height. And what is body surface area? Can anybody tell? How is body surface area calculated?
The square root of height times weight over
Okay,
speed of 600.
correct. So under square root of height into weight, they are divided by 3600. So there are various calculators nowadays available on app based. Have anybody used an app based calculation for a body surface area? There are apps also available. So you can put the height, weight and get an instant calculation of body surface area. Etoposide capsules for extensive. So the molecule is Aptanib 250 milligram. This is another regime with etoposide 50 milligram on day 1 to 21 days. So it is a overall 28 days cycles protocol, and the treatment continued until disease progression. So etoposide capsules as a maintenance therapy for extensive CLC, that is lung cancer, small cell lung cancer. All patients received 6 cycles of etoposide plus platinum. So maintenance treatment, which is given as with etoposide capsule once a day for 20 days, and 28 days cycle to be continued until disease progression. So stage 1 dose is 25 milligram, and stage 2 dose is 25 or 50 milligram. In testicular cancer, etoposide dosage recommended is 70 milligram per meter square once daily on day 1 to 4 in combination with other approved chemotherapeutic agents every 3 to 4 weeks. So alternative administration of etoposide 100 milligram per meter square once daily on day 1 to 5 in combination it is given. Side effects are low BP, hair loss, constipation, or diarrhea, metallic taste in the mouth, or bone marrow suppression. So, can anybody tell what is bone marrow suppression? Hello? Hello? So, bone marrow suppression basically is uh, managed by giving granulocyte, that is filgrastim, GCSF, that is granulocyte stimulating factor, which helps in building the platelet. So even if this side effect is there, doctors give filgrastim or granulocyte to manage the. So composition wise, Actitop has each capsule contains 50 milligram, which is a packing of 8 capsules, and Actitop 100. Each capsule contains 100 milligram of etoposide, which is a packing of 4 capsules. And Actitop 100 milligram injection. Each vial contains 100 milligram per 5 ml, which is a single vial packing. So Actitop injection is indicated apart from testicular and small cell lung cancer in acute leukemia, bladder cancer, malignant lymphoma, thromboplastic diseases. Okay. So see, the cancer definition and the cells, they are evolving nowadays. So here we saw there are different cell cycles, there are different genomic factors coming in. So depending upon that, nowadays even the treatment is evolving. So dosage and administration in testicular cancer, the usual dose combination approved is 50 to 100 milligram per meter square for 5 consecutive days, or 100 etoposide 100 to 125 milligram per meter square day, or 1/3 and 5th is also commonly used. So chemotherapies courses are repeated at 3 to 4 weeks intervals after adequate recovery from any toxicity. So if there is a toxicity, doctors do adjust the dosage or give medications to manage the toxicity, but ensures that the therapeutic dose which is recommended in the trial and the indication is given to the patient. So etoposide injectable dosage recommendation is in combination with other approved drugs is 35 milligram per meter square for 4 days to 50 milligram per meter square for 5 days. This cutaneous kyphosis, this is another indication where etoposide regimen is used. That is VP16, that is 150 milligram per meter square per day, IV for 4 to 6 hours from day 1 to 3 for 28 days cycles. Is it clear? Any doubt till now? SLA, Remer?
No, it is clear. You can continue.
testicular tumors. So these are different regimens, as I showed you in cell cycle. Different molecules in oncology act at different phases. So this is overall to restrict the tumor growth. Combinations are used. So etoposide 100 milligram per meter square per day, IV from day 1 to 5. Dose adjustment is done by 20% if prior radiation therapy or XRT is given, prior the chemotherapy, other protocols with radiation are given. Cisplatin 20 milligram per meter square per day, IV from day 1 to 5, and bleomycin 30 units IV, day 2, 9 and 16th day. So the question that monitor cumulative dosage and pulmonary toxicity has to be monitored. So this is repeated for 21 days cycles. Another protocol which is called VIP. So etoposide, ifosfamide, cisplatin, mesana. So these are different protocols which are given in testicular cycle for 21 days. So storage which is recommended in the cool place. Etoposide packaging, as you know, it is available in 100 milligram, and other two formulations are there. Is it visible? Packaging is visible?
Yes, yes.
Can you tell me which strengths it is available? What strength you can see on the packaging?
What did you say?
What is the strength on the packaging? What is the dosage formulation? How many strengths formulations you can see it on your screen? Hello. Which are the three formulations which are available?
Uh,
I had shared etoposide, Actitop, etoposide 50 milligram, which is a packing of 8 capsule, Actitop 100 mg, which is a packing of 4 capsules, Actitop 100 mg injection. Okay, is it clear? Hello?
hello.
Yeah. Any doubt,
Yes.
Tesele? Any doubt till now?
No doubt, it is clear.
Yeah. So anything in oncology apart from this product, if you have any doubts, you can ask me. See, my name is Ajay Utekar. I'm basically into marketing function reporting to Dipti madam based at India. So I started my career as a pharmacist. I didn't brief you about myself. And 6 years into oncology, sales, market, and recently into marketing function. That way. So any other doubt you have?
Mr. Raj,
Hello? Ajay Utekar. Yeah.
Mr. Raj, can you
Any
share the
question?
slide?
Any questions you can type and chat also, or you can speak also as you are comfortable.
Can you share the slide?
Hello? Yeah, speak up.
Mr. Ajay,
Yeah,
can you share the slides?
I'm not
Stop.
able to hear you clearly. Can anybody hear him? Mamushif. Yeah, Tasale. Rahmat. Any questions? Any doubt?
Mr. Ajay,
Yeah,
please
I
share us the slides.
share the slides to you, means
Yeah.
to mail you. You want me to
Okay.
mail your link?
Okay.
Okay, I'll ask madam, and tomorrow we'll be having. So after that, madam will, I'll just discuss with madam and we'll share it to you accordingly.
Thank
Any
you.
questions? Any questions? Mamushi,
Yes.
Ismail, Rahmat, Ali, any questions?
Yes, it's clear, Mister. Thank you.
Okay. So, shall I continue with another brand or what do you suggest?
You can
Hello.
continue tomorrow. We
Okay,
we will
okay, okay.
continue.
Yeah, means I just wanted to understand your comfort too, because you are sitting since morning. I
Yeah.
understand to sit at a stretch, it is very challenging. Okay, so any doubts you have, you can chat and message us to madam, or you can mail to your representative, or you can jot it down today and you can ask tomorrow also.
Okay.
Okay,
Thank
just a minute, I'll just speak to madam and get back to you.
you.
Hello, hello, I'm audible.
Yeah, yeah.
Yeah, Tasele, who is your team leader here? Who is the team leader?
We don't have that.
Okay, okay. So can I take one more brand today? That is Emthex, methotrexate, and rest we can start tomorrow.
Okay. You
Huh?
can continue. Yeah.
Yeah, only one brand I'll take, and then we can rest brands we can do the training tomorrow. Okay, yeah. So I am starting with Imtex.
Nama ko man. Ah,
Yeah, the slides are visible to you. Hello.
yeah, it's visible.
Yeah. So there are not much slides. There are only 12 slides in this. So I will take quickly through Imthex, which is the brand of methotrexate. So methotrexate is basically a most you can say all-rounder drug. It's a widely used anti-metabolite which is used in various indications starting from ALL, breast cancer, GTT, that is gestational trophoblastic tumors, non-Hodgkin's lymphoma, osteosarcoma, stomach cancer. So it has variety. So it is an anti-metabolite basically. So Antimetabolites are structurally similar to components of the DNA. So methotrexate is the most widely used antimetabolite. So coming to the composition, it's an uncoated tablet which is 2.5 milligram, and each uh, plastomate 50 milligram injection. In your country we have 2.5 and 50 milligram injection. So the composition you can see 25 0.25 milligram. So mode of action, basically methotrexate, it inhibits the enzyme that are important in the DNA synthesis. So they incorporate themselves into DNA molecule. Methotrexate inhibits the cellular enzyme system that produces folic acid. Because folic acid is essential to DNA synthesis, its inhibition impairs DNA synthesis. All mechanism impairs DNA synthesis, causing to cell death. So in short, to understand, methotrexate inhibits the DNA synthesis. So indications, already I briefed you, there are multiple indications. So it is one of the molecule in the oncology which is used in hematological cancers, it is used in solid tumors, both type of leukemia, lymphoma, osteosarcoma, lung cancer and head and neck cancer. So toxicities associated with methotrexate are myelosuppression, nausea and vomiting, anemia, liver damage. These are some of the side effects which are predictable and manageable with proper medications given. So dosage wise, in methotrexate has different dosage in different indications. So in head and neck cancer, methotrexate dosage is 40 milligram per meter square, is given at weekly intervals till response is seen. And thromboplastic tumors, methotrexate dosage is 15 milligram per to 30 milligram daily, is administered daily orally or intramuscularly for 5 days. A repeat course is given after a period of 1 or more weeks in case of thromboplastic tumors. Leukemia, the methotrexate dosage is 15 to 30 milligram per meter square orally, intramuscularly or intravenously. Everybody understand intramuscular, intravenous? Hello, Rahmat?
Hello.
Yeah, everybody understands intramuscular and intravenous, no?
Yeah, we understand.
So dosage, psoriasis, the indication is 10 to 25 milligram orally, which is given intramuscular or IV for 2 to 3 months. See, anybody is new in pharma or newly joined, please ask questions. Do not hesitate, because I understand depending upon your experience, and so somebody is fresher, you can ask, or you can chat and ask, you can type and ask. Okay. Rheumatoid arthritis, dosage for methotrexate, single oral dosage is 7.5 milligram once weekly, and oral dosage of 2.5 milligram at 12 hours interval is given thrice once weekly. The therapy is given for at least 2 years. How does methotrexate works in rheumatoid arthritis? So in rheumatoid arthritis, methotrexate, the orthopedicians and they use to help the fight the inflammation. So methotrexate is thought to work by causing cells to release a molecule that blocks the chemicals that promote inflammation, according to Arthritis Foundation. So it has a immunosuppressant effect also, and anti-inflammatory effect. So it reduces the inflammation, helps prevent pain and joint damage experienced by people with the disease. It reduces pain by reducing severity of the disease. So presentation wise, packaging 2 ml vial. So methotrexate, as you can see, 2.5 milligram and 50 milligram. Uh, Any questions on methotrexate?
It is clear.
Okay. So shall I take another brand or what do you suggest?
Yeah.
Shall I take one more brand, Capexil, so that tomorrow it is easy to wind up? Are you all able to attend now or shall I take tomorrow?
Tomorrow.
Tasele, can I take one more brand, Capexil, and we can keep breast and
Yes, yes.
how is your stamina? Because since morning you are there, that's why I'm asking you. Is it comfortable? Shall I take one more brand or you suggest me tomorrow?
It is not. And January is not. Huh?
Yeah,
Shall we
Tasele,
discuss?
shall we keep tomorrow or can I take one more brand? Everybody is comfortable?
Uh, we
Hello?
can't do by tomorrow, Mr. Ajay.
Yeah, shall we do tomorrow then?
Yeah, yeah. We can by tomorrow.
Okay, so I'll just speak to madam and get back to you.
Huh? Madam?
I'll just speak to Dipti madam and inform you in 5 minutes. 2 minutes, just 2 minutes. Hello, Tasele.
Hello.
Yeah, so we will disconnect everybody. Thank you very much. Any doubts, any
Okay.
question tomorrow you can ask. Tomorrow at what time you are starting? Can
Okay.
you?
Thank you very much for your presentation.
Yeah,
We haven't any doubts. It is clear by them.
yeah,
And thank you very much.
yeah. Tasele. So tomorrow you are aware about the timings, no? Tomorrow what timing is given to everybody?
Yeah, yeah. Yes.
Tomorrow what timing is given to everyone?
Hello.
One.
See,
Yeah,
tomorrow, according to Indian time, it is 10:30.
okay, okay. So thank you very much, friends. Tomorrow we will
Okay. Thank
connect.
you, Mr. Ajay. Thank you. Thank you very much. And Mr. This is Mrs.
Yeah, everyone can disconnect.
Mr. Reeves, Mrs. Reeves.
Okay, okay.